We will be about 1 minute. About 1 minute. More? All right, Tracy, I have 2 o'clock. Is that what time you have? Can you hear me all right? Let me see if I can hear you.
Can you hear me?
No, just keep talking. You're probably not close enough to your microphone for it to engage.
Good afternoon.
There you go.
I'm Tracy Aaron. I'm here from the Health Department, and we are going to be talking about COVID-19 over the Lake Cumberland District Health Department. I have some members from the executive team here that's going to be sharing some updates. Sean, I'm going to turn it over to you and let you start us off with case updates.
All right, thank you, Tracy. I'm going to turn to the side here so I can see our situation count on our board. We've had a total of 608 cases in Adair County. 487 of those have been released. 24 have deceased, leaving 97 active, 93 of those isolated, and 4 in the hospital. Adair is in the red range of community spread right now. Red critical meaning 25 or more per 100,000. In fact, they're at 54.31 per 100,000 right now. So, KC is 386 total cases, 16 deaths, 299 released, leaving 71 active, 67 isolated, 4 in the hospital. KC is in the red critical range. 25 or more per 100,000. They're actually at 53.93 per 100,000 at the moment. Clinton County's had 278 total cases, 4 deaths, 241 have been released. 33 cases are still active, 26 are isolated, 7 are in the hospital. They're in the red critical range, 25 or more per 100,000. Right now they're at 27.96 per 100,000. Cumberland has 191 total cases. They've not had experienced any deaths yet. 156 have been released. 35 are active, 30 in isolation, 5 in the hospital. They're in the red critical range. They're at 71.28 per 100,000. So they're the highest concentration or the most aggressive spread in our district at the moment. Green, 377 total cases, 10 deaths, 335 released, leaving 32 active, 30 on home isolation, and 2 in the hospital. They're in the red range at 36.56 per 100,000. Macquarie has had 309 cases, 1 death, 269 released, leaving 39 active cases, 38 of those isolated, 1 in the hospital. They're in the red range at 30.68 per 100,000. Pulaski, 1,143 total cases, 12 deaths. 1,012 have been released, leaving 119 active. 118 of those are on home isolation or self-isolation, 1 in the hospital. Pulaski just eked into the red zone last night at a 25.06 per 100,000. Russell just dropped out of the red. They're our only county that dropped out. They dropped out last night into the orange range. They're at 23.11 per 100,000 right now. They have had 445 total cases, 7 deaths, 390 released, 48 active, 42 are on isolation, 6 in the hospital. Taylor's had 626 total cases, 7 deaths, 514 released, 105 remain active, 103 are on self-isolation, and 2 are in the hospital. We've had a lot of cases in Taylor County associated with the university there, and a lot with team sports. Wayne County, 349. Total cases, 2 deaths, 282 released, 65 active cases, 63 isolated, 2 in the hospital. Wayne's had a pretty large cluster of cases in their jail. Also in the federal prison in McQuarrie, we've had a pretty substantial cluster. The most common area right now we're seeing, before we isolate someone, the most common place that they have been is school related. Then would be business related behind that. Our total for the district, 4,712 total cases, 83 deaths, 39, 85 or 3,985 have been released. That's 644 still active, 610 on home isolation, and 34 in the hospital. We don't have an individual county count today, but I understand we have well over 100 cases today. So yesterday was our district record on total new cases, and we are possibly on pace to beat that today. We don't always report every case at night. Some of the investigations haven't concluded by the night's end and has to carry over into the next day. We report the cases on the day that their investigation would be complete. So either the day we get the labs, we of course start the investigations on that day, and we report them on the day the information is complete. Last night in the Daily Brief, I made a comment about, we only have a few employees, and we've got so many cases right now, it's difficult for our staff to keep up. We sometimes have to push cases that come in the evening until the next day, and that seems to be happening more and more often. I think last night we did a pretty good job of getting everything assigned and the investigation at least started, but it's becoming troubling. When we do contact tracing, when we identify close contacts and we get those people quarantined before they convert to a positive case, that means they're already on quarantine if they turn positive, and they're not out spread. Anywhere from 15 to 25% of our contacts that would become positives. So we're talking about a pretty big number. Let me see from our brief last night a couple of things I will add. Our mortality rate right now is 1.76%. That means since March, we've had 1 out of every 57 people in our district that have contracted COVID-19 have passed away. We have a 7.45% hospitalization rate, which means we have about 1 in every 13 people that contract it end up in the hospital. So that's a lot of mortality and a lot of hospitalizations, and we're having record numbers of cases. So this is significant. I'm afraid our population has become pretty complacent at this point, and this is still quite serious and has the potential to be very harmful to us. Let's see, we are at our peak number of active cases, and we made a record last night as far as new cases go. So that's sort of where we are. Right now we're projecting our total cases to double every 40 days, so about every 5 weeks or so. So we've got 4,712 cases. If that holds out, that means in 5 weeks we'll be up to pretty close to 9,000, about 9,450 cases, something like that. So it's we certainly hope that the spike we're in plateaus and starts to go down, pretty quick, because we're, as a health department, we're certainly at our capacity. We've basically taken every employee we got, and we're using them for our COVID-19 response in one capacity or another. Plus, we're hiring people as fast as we can, which creates problems too, because we have to train those people. And instead, at the early part of this outbreak, we were using who had many years of disease investigation experience. And now we have a whole lot more people who their only public health experience has been a lot of times what training they got for a few days before they started making their calls. So, it's certainly a challenge that we're under. So I think that's about all I got as far as updates. Tracy, do you have anything specific you want me to mention?
I do not. I'm going to move on to the questions, but I do want to remind everyone that if you're watching on YouTube or YouTube Live, that you can ask questions in the chat box, and please, we encourage you to do that. First question is going to be Dr. I guess maybe Mr. Crabtree.
Tracy, you're sort of cutting out on us. I think Stuart's going to answer the questions. There was 4 of them, and most of them were medical, and Dr. Wayman gave us the answers. She couldn't be here. I think Stuart's going to read the answers, and then we'll kind of segue off into 3 or 4 points that we want to cover today.
Okay. First question. I'm hearing of people who have tested positive who are released from isolation only days later. They spend less time in isolation than someone who is in quarantine due to potential exposure. No new testing is required. What criteria is used to determine when someone is released from self-isolation after testing positive?
Okay, so there's 2 reasons that this might happen. The first reason is an antibody test, which can tell you about a prior infection. So when antibody tests become positive, usually about 10 to 14 days after onset. So a positive antibody test means that the person is over their infection and they're no longer contagious. The other scenario would be when someone has symptoms, but they test many days later. So we count from the symptom onset date, not the date of the test.
Okay, thank you, Stuart.
All right, and there is a question in the chat, Tracy. I'll just try to answer those as they pop in. This is from the superintendent over in Russell County, Mr. Ford. Thank you for the question, Mr. Ford. Mr. Ford's been a really good superintendent to work with. He says he understands our situation as being short-staffed and having staff on medical leave, wondering when our case numbers are going to better align with the state case numbers. That was actually one of the points, Mr. Ford, we had on our notes to cover today, so I'm going to check that off my list and go ahead and answer it now. So there's a communicable disease database that several states use to enter communicable diseases into. COVID-19 is one of those diseases that we enter. So the state reports the numbers that we enter, probably about 90 or 95% of the information that the state uses to fill out its charts and maps and things on their website comes from information entered into that system by the local health departments. There are occasions when a doctor's office or a lab might load that up, which that creates a delay in the state reporting the data because they always have to check for duplicates and do some validation of the data before they report it. So it's not uncommon for the state to be 2 or 3 days behind us in getting the numbers reported. Complicating that problem, though, we have had and are having a very large surge of cases, and we've actually got several staff out on medical leave, but one of our key staff in our epi office went out on medical leave, and the entering data into that system has fallen behind, basically because we have to decide what are we going to do. Are we going to do the case investigations and contact tracing, or are we going to enter the data? Because we only have enough employees sometimes to do part of that. And we have made several major adjustments internally over the last couple of days to try to realign our resources so that we can get caught up. We hope to get caught up by the end of the week. So if you don't know what Mr. Ford is talking about, the state map is showing, I think, maybe 8 of our counties in the orange and 2 in the red. That's probably pretty close, when actually we have 9 of our counties in the red and 1 in the orange. And Russell County, as I said, just dropped into the orange last night. I expect we'll go back into the red tonight based on the volume we have today, but I may be wrong about that. So our numbers on our local site is accurate. So the schools and the communities should look at our local numbers and not the state numbers. It'll probably take us to the end of the week or early next week to get things caught up, assuming that we're not just totally tidal waved with new cases. This is not just an issue in Lake Cumberland; it's an issue statewide, and we're trying to deal with it. But you know, there's only so many public health workers, and there's only so much that we can do. So we're making every effort to get that caught up so that those numbers will align better. If we don't have a giant tsunami of new cases, and 100 cases a day really does push us, because that's taking every resource we have. Hopefully by the end of this week or early next week, we'll be caught up, and then it'll probably take the state a couple of days beyond that to get the numbers reported. So I hope to have updates on that, you know, maybe today and then in today's brief or tomorrow. So Mr. Ford, you can respond to that in the chat box there on YouTube if that didn't sufficiently answer your question. So thank you. Tracy, do you want to jump on down to the next submitted question, please?
Yes. I would like to follow up on determining isolation based on onset symptoms. I have read research that indicates a person is more likely to be contagious early on, even prior to showing symptoms. One reason for wearing your mask, but everything I have read suggests that a person may no longer be contagious 10 days after symptoms are resolved. Could you please elaborate on the criteria being used to end isolation and the basis for that?
Okay, so there's been several studies done that most people with mild to moderate disease, they're no longer contagious after the 10th day from symptom onset, providing that they've not had a fever for 24 hours and their symptoms are improving. So they would be released then in that case. Now, there are instances where there is severe disease, and in those instances, it can prolong the viral shedding. So the CDC recommends a 20-day isolation period, and the person has to be improving. So what that means is in these cases, most of the time when people are at home and they can recover at home and they're getting better, then usually a 10-day. But for the severe cases, so hospitalized cases, a lot of times those will stay in for the 20-day isolation period, and they need to be improving and, of course, fever-free for 24 hours.
Thank you, Stuart. Next question. Will a person with only GI symptoms of COVID test positive with a nasal swab test?
Yeah, so this one's really an easy answer. Yes, these the nasal swab test, they're very sensitive to that. I believe these are the RNA tests that pick up the pieces of ribonucleic acid. So yes, they will.
Okay, next question. Which COVID test is the most reliable? Swab with the throat or nose or the rinse?
So the most reliable test is the nasopharyngeal swab. But the others, including saliva, are also reliable. They may be a little less sensitive, though, than the nasopharyngeal test. So the nose swab is going to be what we call the gold standard test, is the nose swab.
Thank you.
So again, we'll remind everyone that to submit any questions you have. If you're watching live, we have 50 people watching live right now. So if you have something you want answered, please do so. Was there any more submitted questions, Tracy? Otherwise, we've got a couple points we're going to go over.
I do not have any more questions.
Okay, so one of the things I wanted to mention was about schools, and Mr. Ford is on the watching the program, he can't really rebut what I'm saying in this format, though. The most common question I get, or one of the most common questions we get, and we get this question probably a dozen times every day, is why are the schools still in session when they're in the red? And we consistently tell the public that, by statutory authority, it is up to the schools to decide when they open and close, not us. We provide guidance to the schools, and the schools make their own decisions. So, my advice to any parents or any community members who are concerned about the decisions that the schools are making would be to reach out directly to their administration, not to us, because we don't have the authority to make that decision on behalf of the schools. We know our schools administration are sincere and they care about the kids and they've put together good plans and they're trying real hard. COVID-19 is a really difficult situation. From a strictly control the disease perspective, we would suggest schools not be open during a pandemic, particularly if you're in the red guidance. But we also understand there's a lot of things that people take into account other than just the disease spread when they're making these decisions. I do know right now that we're having a major spike in Kentucky. We're having a major spike in Lake Cumberland. And I know that 1 in 50, did I say 3 or 4 people that have historically in our Lake Cumberland area have died from it. And about 1 in 13 end up in the hospital. So that's a lot of pain that can happen. And of course, schools are not the only factor. We see complacency in our communities, and it's gotten to the point now where I would say it's even more than just complacency. We see a lot more open resistance from businesses. Businesses really pushing back when we quarantine people, and businesses pushing back about following the guidance. And we see individuals when we do our investigations and quarantining, contact tracing, that we are encountering more resistance during that process. So, I don't know. I know that there's supposed to be a vaccine coming, on a limited basis toward the end of this year, which would be more broadly available by late spring or early summer next year. Personally, I would like to see as little death and as little hospitalizations as we can manage between now and then. And the biggest things that we can do is wear our masks and try to avoid crowds and try to keep our distance from people when we're out, and making sure that we're sanitizing our hands and our homes and just enhance our sanitations. Stuart, do you want to talk about guidance for when a county goes into the red?
Okay, so as Sean said, we have 9 of our 10 counties in the red zone, and potentially with today's numbers, there is the potential that we'll have all of our 10 counties in the red zone. So the new recommendations that are out are as follows. So employers, they need to allow employees to work from home whenever that's possible. We know that we have a lot of workplace quarantines happening, not necessarily that they're exposed at the workplace, but when we gather these people together, then the potential is there. So if employees can work from home, it would be good to allow them to do that. We do that here at the health department. For those that can work from home, we allow them to do that. Non-critical government offices to operate virtually. So if there is any government office out there that is not a critical need office, then if they can operate in a virtual manner, reduce in-person shopping or order online or curbside pickup. So try to stay out of the stores as best you can and do the online pickup that places have, such as Kroger and Walmart. order takeout, but avoid dining inside the restaurants or bars. So we know that COVID is not a foodborne illness. And as far as the risk from touching your container that you would get through a drive-through is much lower than the risk from eating inside a restaurant or being inside a bar where people are crowded in together under one roof, one ventilation system. So avoid doing that. Prioritize businesses. This is a very good one. Prioritize businesses that follow and enforce mask mandate and other guidelines. So Sean and I both spoke about it takes everybody to help us on this, and that we need the general public to own this. So when you go into a business as a patron, and if they're not following the mask mandates, find another business to shop at. Reschedule or postpone or cancel any public and private events. Those events that bring large groups together, we know that we have very much an increased chance of transmission in things like that. Events, private events, we see that loads of our cases end up coming from the small social gatherings, and we would ask that you would discontinue those, especially when your county is in red, which is actually part of the second or the next recommendation. That's do not host or attend gatherings of any size. So even though a gathering is limited to 10 right now, 10 is not a magic number. You can have a gathering of 5 and transmit COVID. You can have a gathering of 2 and transmit COVID.
Because the odds are smaller.
Yeah, the odds are smaller, and the contact tracing would be a little less on us, but it doesn't matter. If you have more than one person, then the potential is there if they're not your household contact. Avoid any non-essential activities outside of your home. So the things that you don't need to do as far as going out. Now, we're not talking about going outside into your yard, but any non-essential activities, try to just limit those to the very bare minimum. And then reduce all your overall activity and contacts and follow the existing guidance, including the 10 steps to defeat COVID-19 that you'll find on the KY COVID website.
Thank you, Stuart. There was a comment in a YouTube Live from Karen Hall. If I'm not mistaken, that's our very own Karen Hall that works here at the Health Department, who says, when I speak with local businesses this week, Karen is one of the folks that does follow-up when we get complaints on businesses. And she says she's been encouraging them to do public relations, doing a mask PR contest to try to get their employees more, using more creative way to promote awareness and compliance to wearing the mask. So thank you, Karen. Karen's a good one. Got one of the biggest hearts of anybody you'd ever meet, I think. So thank you, Karen. A couple other final points. If anyone wants to type into the YouTube live chat a question, we're winding down here. One of the things I got asked about several times this week was, why is it that our local leadership in the counties will say things like, we've not seen any cases traced back to things like a water park or a parade or a downtown community event or a festival or a fireworks show or things like that. And the event planners will make the statement that, well, nothing's been traced back to these events. To which I would say that's really a misunderstanding of the way this disease is traced. We don't trace them back to those events because we don't have a way to trace them back to those events. We can trace clusters back to churches because people know in a church who they were sitting by. We can trace clusters back to weddings or funerals because people know who was present. When you have a parade or a water park or a big outdoor event, you have no clue the names of the people that you were around. Now, maybe you went with your best friend or your family, which we would trace that. But we can't trace these things back to these events. It is undoubted that these events have contributed to the spread of the disease. Just because we can't trace it back because there's no good way to do so doesn't mean that doesn't happen. So that's just a very narrow way to look at the way contact tracing works. So, I wish folks, when they were making those kinds of statements, would better educate themselves before they say things like that. It tends to give misinformation to the public. It gives the public a false sense of security about these situations that are not safe. It's not safe right now to be around crowds of people. So, again, that's not a good thing to be saying to the public. Stuart, do you have anything to add to that? You're more the environmental expert.
No, I mean, I totally agree. As you know, as many of you are aware, within the past week, we made the decision here at Lake Cumberland not to review plans for any type of large gatherings going forward. And the reason is, Sean alluded to there, that we believe that the plans were made in good faith. I mean, we think that they nobody made these plans with the thought that they weren't going to carry them through. I think everybody had a good effort on that and had good intentions. But we know that invariably, whenever these things happen, that there's not necessarily a way to police them. And we will get pictures and complaints from every one of these on social media where people said, well, this person, they're not following the guidance, and you guys allowed this large event to continue. One thing is it's not anything that we allowed. We reviewed their plan against the guidance, and the guidance would allow for some of those things. But right now we see that our recommendation is don't have any social gatherings. We know that there's actually no way that you can police an event such as a parade. Now, everybody may get together and do exactly what they're supposed to, but that has not been the case so far. We haven't seen that at all so far. So invariably, the planning's great. The execution ends up not working out near as good. So,
and then I've heard some of the event planners say, well, we saw a lot of compliance, and that's probably true. There's probably a lot of people who are trying to be compliant at these events, and but I think people see what they want to see. If you tend to want to see compliance, that's what you'll notice, and if you tend to want to see non-compliance, that's what you'll notice. So people kind of notice where their where their personal allegiance lies on this issue. That's what they tend to notice the most. What I'll say is, even if there is a large degree of compliance, a significant number of minority, significant minority can create a lot of problems when you're dealing with a pandemic. Just think about one person who's contagious and coughing, walking around with these events, just how many people they can expose. Because, when you cough on somebody, it just takes a second. And if you've got a group of 100 people, you got one person sneezing or coughing, it can create a lot of pain. So the other point I'll make, let's see, we got different comments popping in. Al Gibson says, thank you, Al. Gail Cowan, Judge Cowan says, thank you all, hang tough. Judge Cowan, thank you. Judge Cowan's one of the judges in my district. She's the county judge executive over in Adair County, and she consistently sends me very encouraging and positive messages when she knows I'm working late at night, and I always appreciate her being encouraging in that way and offering assistance. Becky Spillman, that's somebody that might be close kin to Stuart. Mm-hmm. Says, thanks for everything you all are doing. You all are appreciated. There's a big heart. I imagine the heart's probably for me, Stuart.
It probably is. Sometimes I don't sometimes I don't deserve the big heart, so it might be for you.
Becky, if that's for me. Judge Craig says, he's our judge in Clinton County. Did you get my question regarding proper mask procedures for church gatherings? Judge, I didn't, but I'll let Stuart address that. What would you suggest as far as distancing and maskings for church gatherings? What's the guidance, Stuart?
Okay, so on churches, and I'm gonna use some anecdotal data that we have here. We know that without a doubt, any extended gathering and under the same roof, the more people you have in a room, then the greater amount of aspiration that you have. So you're breathing out that virus, then can multiply, and then you're using this ventilation system. So let's say that you don't have the windows open, so that's going through the ventilation system. And we know that our ventilation systems, for the most part, are not these super high efficiency ventilation systems that the hospital would have. And even in a hospital room, I think we saw that it takes, I want to believe that with the ventilation in most normal hospital rooms, you're looking at about 90 minutes from the time you have a COVID positive patient. The recommendation is to go in there and clean, and then to bring somebody else into that room. So we know that, I mean, our church buildings don't have that level of air filtration. So our recommendation is anytime that you are in a room like that, everyone should be masked. Everyone should be distancing 6 feet, even masked whenever they sing. And singing would be discouraged, because singing, again, causes more of that aspiration of those droplets for them to be broadcast further. So even that is discouraged. And we have had, Sean can talk about, just as he sees every case in the log every night, we have had multiple churches with cases and outbreaks associated with those churches. But also to say the churches that have followed that guidance, they've been able to keep that down to small numbers.
You know, we have had a single case that's presented at a great many churches, and most of them don't turn into the clusters, particularly when they're following the guidance. So when we do see the clusters in the churches, it's most of the time it's churches that aren't social distancing and masking, and some of our biggest clusters have come from church events where people weren't social distancing and masking, even at revivals, particularly at revivals, even outdoor revivals. So there's your proof that outdoor is not the cure-all. So you know, we can track a cluster back to an outdoor event like a revival because people generally know who they're sitting around. So that just goes to show you that public outdoor events, you know, it's just because it's outdoor doesn't guarantee you're not going to have issues. Let's see, Judge Craig says we've had citizens concerned about the churches allowing the same procedures except for restaurants, only wearing them as they enter and taking them off once they get inside. It's pretty important you keep your masks on. That's going to reduce the chances you're going to get someone else's droplets. You're going to inhale someone else's droplets. And in churches, when people are worshiping enthusiastically, and if they're singing, you're projecting a whole lot more droplets than you are if you're just talking in a normal tone of voice, or if you're just breathing. So the shouting and the praising and the singing makes the, you know, generally you think 6 foot is good, but if you're singing, shouting, praising, 6 foot's not as good. You need more than 6 feet. So keeping that mask on is really important. One final point, and Judge Craig is another one of the judges that is always very encouraging to me, and I've always appreciated that too, Judge Craig. I'm going to try to share my screen for just a second. Let's see. Tracy, you said we're breaking up bad. Who's breaking up? Is it me or is it Stuart?
It was you, but you're good now.
All right. Did we miss something really important?
I think they probably got you because you were talking slow and not fast.
Okay. I may have had my arm over my microphone there. I'm going to try to share my screen for a second, and I'd like to show you all something on our website that I think is very interesting. Tracy, what are you seeing right now?
I'm seeing that you need to click into Zoom. You probably need to highlight that document and share it, Sean. It's not sharing.
Okay, I just want to make sure. Are you seeing Google now?
I am, yes.
Are you seeing Google, Tracy? Okay.
Yes.
So when you go to our website, I have two screens, so I never know which one's being projected. When you click our main COVID-19 banner, down toward the bottom, of course, this page takes a second to load, but there's lots of graphs and things on this page. What I'm trying to get to, and if anyone's interested in our master data set, it's right here at the bottom of this page. But if you go under this information and updates, there's a CDC case information by state link. Now this takes you to the state's website, or not the state, the CDC's website. And it's got compare state trends is the one I like to look at. And I like to set it to rate per 100,000 instead of raw numbers. That makes sure you're comparing apples to apples. And then you can see how Kentucky's performing against other states. It's defaulted in with some of these but I'm going to put in like a, I don't know, Kentucky, maybe Georgia, and I'm not going to do a bunch of these. I just want, because we know that the southern states have been generally less restrictive on the guidance than the northern states and the coastal states. But you see a few weeks ago, Kentucky here is the purple. There was a very, very large spike in most of the southern states. And then that kind of passed by, and Kentucky kind of avoided that. But if you look now, you see in Tennessee, they're having a substantial second spike, and Georgia to a lesser degree is spiking. But Kentucky is, as of today, we're worse than either one of those. So, you know, we're now about as bad as these states were when they were having their hospital problems and so forth. So, you know, we're getting there, and our spike hasn't plateaued yet. So I'm just showing you all, you can mess around and look at that. You can see how it's unfolded in the states that have had more restrictions versus the ones that didn't. But you can kind of see where it looks like we're heading. It looks like we're not out of the woods with COVID-19 by any stretch. So if you get a chance, take a look at that. I don't see any more questions in the chat. Stuart, did you have anything else you want to say before we log out?
Just our normal, please avoid crowds, large gatherings. Try and do what you can to stay in. If we can actually do these things, the faster, the better that we can do these things, then the quicker that we can get through this. I know people are tired, but we have to wear a mask and we have to wash our hands. We have to stay away from people. If we want to get back to normal, that's what we need to do. So we see that right now, I mean, there's largely non-compliance out in the community, especially when it comes to small group gatherings. But this is the kind of thing that it takes for us to get through this.
Yeah. And I'll remind everyone, at the health department, we're about maxed out. And if the surge goes much higher, you know, we won't be able to keep up with the contact tracing. And when we're not catching those close contacts and getting them quarantined, that's more people that'll be in the community spreading it. And it'll just make it amplify at an even greater pace. So help us, please. You know, my staff are working a lot of hours and they're drowning. Be a really good time to start social distancing and wearing your mask. So a couple of weeks from now, we can really see our numbers drop off. Final comment, Michael Haynes says, thank you all for the work you do. Well, thank you, Michael. All right, I guess that's it. Tracy, when are we going to have another update?
Our next update will be Wednesday, November the 18th at 2 o'clock. I encourage you all, if you have questions, please send those our way. Melanie Williams here at the Health Department. Also, I want to remind you that we do update our numbers, and they're on our website daily, so you can get that information. Sometimes it's very late at night when that goes up, but it is on our website. And also, Sean, we need to remind everyone to get their flu shot if they have not, flu vaccine.
Yeah, we are in cold and flu season right now, which really complicates things. So you don't want to get COVID and flu at the same time. You would have two things going on at once that compromises your immune system. So it could be very, very difficult situation for you. Okay, well, thank you all for tuning in, and we'll see you in a couple of weeks. And as Tracy said, we apologize for getting our news briefs out so late. The fact is, we got a lot of staff having to work a lot of late nights right now trying to just keep up with the increase in cases. So we generally don't do our reporting until we have as much of that done as possible. So, but thank you all for reading that and for your understanding. And please wear your masks and social distance. God bless you.